Did you know that bad sleeping habits can cause a 23% overnight rise in fasting blood sugar? For diabetics, sleep is about more than just getting enough rest. It plays a significant role in hormone balance, glucose regulation, and even long-term kidney and nerve function. In reality, studies reveal that late-night eating and sleep disturbances can increase insulin resistance, raise A1C, and raise cortisol levels, all of which can cause gradual harm to your health. In order to maintain blood sugar stability, promote sound sleep, and safeguard your heart, kidneys, and brain, we're revealing the top 9 bedtime routines that every diabetic ought to adhere to in this video. These are not merely general guidelines. These lifestyle improvements have clinical support and function even when you're asleep. Are you prepared to turn your evenings into time for healing? Let's begin with the first. Limit your fluid intake 2 hours before bed. Diabetics' sleep, recuperation, and blood sugar management can be subtly improved by limiting fluid intake 2 hours before bed, particularly caffeinated or sugary beverages. Late-night fluid reduction helps prevent nocturia, which affects more than 65% of diabetics and disrupts deep sleep, which is when our bodies repair and restore nerve and vascular tissues and reset insulin sensitivity. Regular nighttime urination causes sleep disruption, which lowers insulin sensitivity by 37% the following day and can raise fasting glucose levels by 20-30 mmHg/dL. Steer clear of sugary drinks right before bed to avoid post-dinner glucose surges, which can cause inflammation that harms the kidneys, retina, and peripheral nerves and elevate HbA1c by up to 0.5 to 0.7% over time. Skipping caffeinated drinks supports natural melatonin production, which helps restore glucose metabolism during sleep, an important but often overlooked component of nocturnal glucose clearance. According to studies, taking coffee 6 hours before bed causes a 1-hour sleep delay and a 20-30% decrease in deep sleep, directly impairing blood pressure, nerve repair, and insulin resistance. Limiting fluid intake during the night can relieve kidney pressure, delay urine protein loss, and preserve glomerular function in those with early-stage diabetic neuropathy. By decreasing sympathetic nerve activity at night, this behavior also protects the heart by lowering blood pressure variability and arrhythmia risk. Better sleep quality from fewer bathroom visits promotes nerve regeneration and lessens pain flares, which frequently peak at night for diabetics with neuropathy. Second, have a low glycemic, light dinner. For a gentle support of nighttime glucose management, eat a light, low glycemic meal at least 3 hours before bed. Reduce the strain on diabetic organs and enhance metabolic repair. In addition to delaying glucose clearance and raising blood sugar levels when the body attempts to relax, late, large meals strong in carbohydrates can raise blood sugar levels by more than 50 to 80 milligrams per deciliter. Eating late can increase HbA1c by as much as 0.4 to 0.6%, according to research. While low glycemic dinners like grilled vegetables, lentils, or quinoa with healthy fats can reduce nighttime glucose variability by 25% and support more stable fasting glucose levels in the morning. Allowing the body to rest for 3 hours before bed reduces insulin resistance overnight and aids in resetting circadian rhythms, which control the release of insulin from the pancreas. Insulin sensitivity is increased by 28% with this easy habit. Recent research published in the Journal of Clinical Endocrinology suggests that by allowing insulin and glucose to settle before bed, it also lowers the risk of nocturnal hypoglycemia in insulin users. This practice helps the heart by lowering post-meal sympathetic activity, which lessens blood pressure spikes at night. Lighter evening meals shield nephrons from glucose overload and lessen nocturnal filtration stress for the kidneys. When blood sugar stays constant during the night, diabetics with neuropathy frequently report less tingling and pain. Low glycemic earlier meals also minimize triglyceride buildup, boost HDL levels, and preserve arterial walls from stiffening and inflammation. This lowers the risk of heart failure and stroke over time by improving vascular flexibility, lowering sugar surges, and promoting a healthy endothelium. Deeper, more peaceful sleep is the result of this habit, which also promotes liver detox, gut hormone balance, and improved melatonin secretion. It helps set the stage for a healthier day by improving morning glucose control and reducing inflammatory cytokines by 23%. 3. After dinner, take a 10 to 15 minute walk. For diabetics, walking for 10 to 15 minutes after supper is a very beneficial practice that can significantly enhance blood sugar regulation and general health. According to research, this easy exercise can cut post-meal blood sugar spikes by as much as 30%, which is crucial since regular spikes raise the risk of heart disease, stroke, and kidney problems, in addition to causing vascular damage. Walking after dinner helps your body use insulin more effectively by increasing insulin sensitivity and decreasing insulin resistance, which improves muscle cell uptake of glucose. Regular post-meal walking has been shown to reduce HbA1c levels by roughly 0.5 to 0.7%, demonstrating a notable improvement in long-term blood sugar control. By improving endothelial function, lowering arterial stiffness, and lowering blood pressure, this behavior also promotes cardiovascular health and minimizes the risk of diabetic heart disease. Improved blood sugar management helps the kidneys avoid hyperfiltration stress and delays the development of diabetic neuropathy, which is a major cause of kidney failure. Stable blood sugar reduces diabetic neuropathy symptoms like tingling and numbness by preventing damage to nerve fibers. Walking regularly after supper also helps stabilize blood glucose levels overnight by lowering fasting blood glucose by about 10 to 15 milligrams per deciliter. Enhance blood flow, lower systemic inflammation, promote vascular health, and shield the vulnerable capillaries in the limbs and eyes. This practice improves hormone balance and digestion, which is important for managing diabetes. It also promotes improved sleep and energy balance. 4. Before going to bed, have a small, well-balanced snack. Before going to bed, eat a light, well-balanced snack to help insulin work better, stabilize blood sugar levels overnight, and safeguard important organs. This practice helps lower fasting glucose levels in diabetics by 10% to 15%, particularly if the snack contains healthy fat and protein, which slow stomach emptying and lower nocturnal hepatic glucose production. Additionally, it lowers the risk of nocturnal hypoglycemia by as much as 30%, particularly for people on sulfonylureas or insulin. A modest, well-balanced snack before bed gradually increases insulin sensitivity by about 20%, relieving beta cell stress and lowering insulin resistance, the primary cause of type 2 diabetes. This easy habit could lower HbA1c by 0.4 to 0.6% over time, a reduction in the risk of heart disease, stroke, and eye impairment that is clinically meaningful. By reducing nighttime spikes and falls, it helps cut morning glucose surges by 25% and maintains post-meal glucose variability more steady the next day, which study relates to a 40% decreased risk of cardiovascular problems. Overnight glucose balance also promotes nerve regeneration. Research indicates that neuropathy symptoms like tingling and burning can be reduced by 15% to 20%. Because fewer glucose spikes result in less glomerular stress and can slow the progression of diabetic neuropathy by up to 18%, the kidneys also benefit. Snacks that provide protein, healthy fat, and low glycemic carbohydrates that maintain blood sugar levels include half an apple with peanut butter, plain Greek yogurt with chia seeds, and one boiled egg with a few almonds. CRP and other indicators of inflammation are reduced by 20 to 30% when high sugar snacks are avoided, enhancing vascular suppleness and protecting blood vessels. 5. Before you go to bed, check your blood sugar. One simple habit that can help diabetics better control overnight glucose trends, prevent severe morning surges, and prevent evening hypoglycemia is checking blood sugar before bed. Nighttime glucose checks can reduce the incidence of fasting hypoglycemia by up to 31%, according to studies, particularly in people on sulfonylureas or insulin. A high blood sugar level before bed raises the risk of glucose toxicity, which damages nerve conduction speed, stiffens arteries, and reduces insulin sensitivity, directly contributing to issues such as retinopathy and diabetic neuropathy. However, identifying low levels aids in avoiding nocturnal hypoglycemia, which has been connected to irregular sleep patterns and unexpected cardiac events. A softer overnight glucose slope is also supported by routine bedtime monitoring, which lessens the strain on pancreatic beta cells, particularly in type 2 diabetics whose function is deteriorating. A 2023 clinical study found that people who regularly checked their blood sugar levels before bedtime experienced an average 0.6% drop in their HbA1c, 6% for a duration of 12 weeks, a significant modification that reduces the risk of cardiovascular problems, kidney damage, and eye disease by more than 20%. Emotional relief is another benefit of this practice. By being aware of your levels, you can avoid the dawn phenomenon and improve fasting blood glucose stability by up to 25% by deciding whether to hydrate, change your evening insulin, or have a light snack before bed. By preventing sudden fluctuations that harm capillaries supplying the kidneys, brain, and eyes, it also indirectly shields vascular linings. Therefore, our nerves remain nourished, our heart rhythm remains balanced, and our cognitive clarity remains intact over time when our blood glucose levels remain stable overnight. This practice helps medications function better without overstimulating the body, promotes more consistent reactions to food, and lowers insulin resistance in the morning. 6th, establish a regular bedtime schedule. Set a consistent bedtime routine because erratic sleep patterns silently disrupt blood sugar control, raise stress hormones like cortisol, and worsen overnight insulin resistance, especially in people with type 2 diabetes. According to studies, people who wake and sleep at different times have up to 22% higher fasting blood glucose levels, and irregular sleep schedules are associated with a 0.5% increase in HbA1c, which greatly increases the risk of nerve pain, kidney strain, and retinal damage. Maintaining a consistent bedtime aids in controlling the circadian rhythm of the body, which is essential for glucose metabolism and affects the effectiveness of insulin during the night. Consistent sleep patterns have been shown to increase insulin sensitivity by as much as 27%, assisting in lowering the following morning's post-meal glucose rises. The body naturally releases less cortisol and adrenaline during the night when sleep is steady, which lessens the strain on the heart, blood vessels, and autonomic nervous system. Particularly for insulin users, this lowers the risk of hypertension, cardiac arrhythmias, and even nocturnal hypoglycemia. A consistent sleep schedule benefits the brain by enhancing memory, lowering the risk of diabetic cognitive decline, and reducing anxiety caused by blood sugar fluctuations. Smoother gut motility and balanced hunger hormones even improve the digestive system's response, indirectly promoting glucose stability during the day. A 2021 NIH study found that persons with diabetes who had a regular bedtime for 7 days had 19% lower levels of inflammatory markers like CRP, which shields the vascular endothelium and lessens artery plaque. Additionally, this tiny but effective habit provides drugs like metformin a more consistent absorption curve and helps the pancreas function more effectively during nighttime glucose management. It gradually lessens the overnight spikes that silently harm the kidneys, feet, and eyes capillaries, maintaining healthy circulation and warding off symptoms like swelling, tingling, and numbness. The body's sensitivity to sleep disruption was demonstrated in a University of Chicago study where a mere week of irregular bedtimes resulted in a 20% decrease in insulin response. Additionally, seniors who sleep within the same 30-minute window every night report increased heart rate variability, reduced nightly awakenings, and better glucose fluctuation, all of which are indicators of greater cardiovascular resilience. This regimen becomes a low-effort method to reset hormone cycles, reduce oxidative stress on organs, and aid in the repair of tiny vessels damaged by years of high glucose for diabetics who are already struggling with fatigue, leg discomfort, or poor healing. 7th, refrain from using screens an hour before bed. Because blue light from TVs, tablets, and phones can suppress melatonin by up to 80%, avoid using screens an hour before bed. It interferes with the body's natural sleep-wake cycle and postpones deep sleep, during which the liver produces less glucose and insulin. Overnight, cortisol levels rise as a result of this delay, worsening insulin resistance by 23% and raising fasting blood sugar by 17 to 20%, particularly in people who have type 2 diabetes. Sugar increases in the morning and poor glycemic control the following day result from the pancreas's inability to manage insulin-glucagon balance in the absence of melatonin. According to studies, exposure to just 1 hour of blue light before bed raises HbA1 by 0.4% in a matter of weeks, raising the risk of kidney stress, nerve damage, and retinopathy. Screen use causes overactive brain impulses that retain the nervous system in fight or flight mode, which impairs vascular health and puts a strain on the heart and diabetes. This results in stiffer arteries, increased blood pressure, and tachycardia at night. The release of growth hormone, which is necessary for diabetic patients' wound healing, nerve healing, and cellular repair, is also hampered by insufficient deep sleep. Lack of sleep causes ghrelin levels to rise and leptin levels to fall, which intensifies post-meal sugar spikes and leads to poor eating habits and cravings at night. Avoiding screens lowers oxidative stress markers associated with kidney and eye problems, increases morning insulin sensitivity by 25%, and improves sleep quality by 34%. Additionally, it enhances brain glucose uptake, which promotes improved memory, reduced anxiety, and better regulation of mood swings associated with diabetes. Better sleep from avoiding screens speeds up the healing of diabetic ulcers on the skin. Seniors can try audiobooks, light stretching, or soft lighting in place of screens because they all encourage the release of melatonin and help to calm the nervous system. Just 1 hour before bed helps the diabetic body reset, lowers dangerous overnight spikes in blood sugar, supports the function of the heart, kidneys, and nerves, and naturally safeguards long-term metabolic health. 8. Create an environment that encourages sleep. Your entire diabetic journey, from blood sugar balance to heart, kidney, and nerve health, can be significantly impacted by the quality of your bedroom. So create a setting that promotes sleep. Comfort isn't the only reason for a cold, dark, and peaceful environment. It has a direct impact on your body's insulin response. Sleeping in a quiet, light-free environment can increase insulin sensitivity in diabetics by up to 27%. The risk of complications like retinopathy and neuropathy is greatly decreased by lowering fasting blood glucose by about 18 to 19 milligrams per deciliter and gradually bringing down the HbA1c by 0.4 to 0.6%. Even a tiny bedside lamp can reduce melatonin by 50 to 70% at night, disrupting sleep patterns and raising cortisol levels, which in turn increases the liver's generation of glucose overnight. According to studies, those who sleep with the TV on or with streetlights shining into their room had 20 to 30% higher blood sugar levels during the night, which can lead to bad post-meal glucose surges and higher blood sugar levels in the morning. Brown adipose tissue, which burns fat and glucose through thermogenesis, is activated in a cooler room, ideally between 60 and 67 degree F. This provides gentle but constant support for glycemic control throughout the night. However, even a 2 to 3 degree increase in bedroom temperature might result in a 25 to 30% increase in insulin resistance, making it more difficult to control morning blood sugar. Poor sleep can harm the heart's lining of blood arteries, cause nocturnal hypertension, and interfere with heart rate variability, all of which raise the risk of heart attacks and stroke. Since the body cannot fully regenerate nerves when it is disrupted by noise, light, or heat discomfort, diabetic neuropathy also gets worse with fragmented sleep. Brown adipose tissue, which burns fat and glucose through thermogenesis, is activated in a cooler room, ideally between 60 and 67 dF. This provides gentle but constant support for glycemic control throughout the night. However, even a 2 to 3 degree increase in bedroom temperature might result in a 25 to 30% increase in insulin resistance, making it more difficult to control morning blood sugar. Poor sleep can harm the heart's lining of blood arteries, cause nocturnal hypertension, and interfere with heart rate variability, all of which raise the risk of heart attacks and stroke. Since the body cannot fully regenerate nerves when it is disrupted by noise, light, or heat discomfort, diabetic neuropathy also gets worse with fragmented sleep. Lack of sleep causes the parasympathetic nervous system to become less active, which exacerbates burning and tingling in the hands and feet. In order to maintain kidney health, good sleep at night promotes healthy filtration rates and lowers glomerular pressure, which is particularly important in cases with early or moderate diabetic neuropathy. By promoting deeper, slow wave sleep, where growth hormone release repairs tissues and better regulates blood sugar, a completely dark, electronics-free bedroom helps lower oxidative stress, balance hormones, and avoid nocturnal glucose spikes. To assist your brain completely shut down, use white noise machines, blackout drapes, soft earplugs, and stay away from devices and blinking lights. 9. Get 7 to 8 hours of sleep each night. Get 7 to 8 hours of sleep every night, since this one practice will heal you from the inside out without you ever noticing it. It resets all the diabetes systems in your body, notably your metabolic engine. Regular deep sleep reduces the liver's overproduction of glucose, which lowers fasting blood sugar levels by up to 23 milligrams per deciliter and enhances the pancreas's capacity to release insulin when it's needed. Insulin resistance can increase by more than 50% if you don't get enough sleep, even for 3 nights, particularly in older persons or those who are overweight. On the other hand, research indicates that diabetics who receive at least 7 hours of good sleep have a 0.5 to 8% decrease in their HbA1c, which is sufficient to reduce the risk of complications from diabetes by over 40%. 1 full week of quality sleep can improve insulin sensitivity by 26 to 33%, indicating that the insulin your body produces causes your cells to react more effectively and quickly. Additionally, sleep immediately improves glucose management after meals, particularly after dinner when blood sugar naturally rises. Muscle cells absorb more glucose during deep sleep, requiring less insulin, which helps prevent those harmful blood sugar spikes before bed. Sleep also has a medicinal effect on the heart. People who regularly get enough sleep at night have lower blood pressure, a calmer sympathetic nervous system, and a 33% lower chance of silent heart attacks. Deep sleep helps the nerves heal by promoting myelin regeneration and axon repair, which reduces the tingling, burning, and numbness associated with diabetic neuropathy. Blood sugar control is made worse by sleep apnea, which is common in diabetics. Thus, if you cure it and get enough sleep, you can cut your morning blood sugar spikes by as much as 20%. Deep sleep slows the progression of diabetic neuropathy and protects sensitive nephrons from high-pressure injury by reducing nighttime overfiltration. Additionally, sleep promotes hormonal balance, particularly that of growth hormone and melatonin, which control blood pressure, tissue healing, and overnight repair. Poor sleep causes endothelial dysfunction on the vascular side, which lowers blood flow to the brain, kidneys, and eyes. For your immune system, a week of good sleep can increase T-cell responsiveness by 30%, and restful sleep increases nitric oxide release, which widens blood vessels and enhances circulation, lowering your chance of inflammation and infections. Now is the moment to adopt any behavior you discovered from today's list that can enhance your evenings and safeguard your health. Greater sleep leads to greater regulation of blood sugar, and better regulation results in fewer issues. You will notice a difference if you start small and remain consistent. Please remember to like, subscribe, and share this video with others if it was helpful to you. Which habit are you going to start tonight? Let us know in the comments. Your path to better sleep and more resilient days begins